going to talk some more about ADHD. So when we think about ADHD, those kiddos have a high rate of all behaviors, right? They're like Tigger, where they're bouncing around, they're doing a lot of things all at once. And the challenge is they're probably doing a lot of things that are really appropriate, and they're also doing a lot of things that are really inappropriate too. It's just a high rate of all behaviors. The problem is because they're doing that stuff so much, what is it that our ADHD children are hearing from adults? They're hearing, quit it, no, running, stop that, don't, no, no, that's not how we. And so we're kind of constantly trying to, because they're showing this high rate of disruptive behaviors, we're constantly giving this negative feedback, right? And let's think about what the impact of that is. One, what's that kid hearing all the time? That they're doing stuff wrong. And so that can impact self-esteem and self-image. And then also, we just talked about how attention can, positive or negative, can be a motivating factor for lots of kids. So every time we say, quit it, no, stop, don't, whatever, every single time you're providing attention for that negative behavior, right? So it's doing two things at once. It's decreasing self-esteem and it's providing attention for negative behavior, which makes it more likely it's going to happen in the future. So what we have to do for kids with ADHD is we have to find a way that we flip that. And so knowing that they've got this high rate of all behaviors, both disruptive and positive or neutral ones, we need to flip it. So that now what they're hearing is, thanks for sitting quietly. I like the way you're sitting still. You're doing a really good job staying on your work. And that way we're flipping it. So they're hearing a more constant stream of reinforcement for what they are doing right. The other thing is that because kids with ADHD have a short attention span, they're less likely to pay attention when you do give them feedback. So we need to make sure that we are really consistent in our response to their behavior. Kids with ADHD, all kids, they benefit from our consistency, right? That's not the reality that we can't always be 100% consistent, but kids with ADHD need that even more. They need more consistent positive feedback, and then they also need to have really good consistency for how adults do respond for negative behavior too. So our overarching goal is to provide positive feedback every time the target behavior occurs. That's the goal. I know that's not reality, but that's what we're shooting for. The benefit is that we're going to flip it, and so they'll get more attention for positive behaviors instead of negative. And then also, because of that short attention span with ADHD, every time they hear that praise, it's going to remind them, oh yeah, that's what I'm supposed to be doing. So if you got a kid who's sitting at the desk and then you walk by and you say, thank you for working quietly, for all you know, they were about to get distracted and start talking to their neighbor. And when you provided that praise, they're like, oh yeah, that's what I'm supposed to be doing, and helps them stay on track. Next slide. I do want to talk a little bit about some diagnostic disparities that exist. So we know that African American and Latino children are less likely to be diagnosed with ADHD. And often instead, they're diagnosed with a disruptive behavior or conduct disorder. We don't think that there's any true differences in the population. We think that most likely this is because we are not identifying those kids who have ADHD as having ADHD. Instead, we're labeling the same behaviors as because of disruptive behaviors or a conduct disorder. That can have some really big implications. Um, because we know that one piece of ADHD treatment is medication. And so if we're conceptualizing this as because of a child's disruptive behavior, we're less likely to offer them all of the array of interventions that might be effective, right? So just some more stats about this. African American children are 2.5 more times more likely to be diagnosed with a conduct disorder than ADHD. And this is also has some relationship with socioeconomic status, where high SES families more likely to have a diagnosis of ADHD. And then families who are low income and use Medicaid are 5 times more likely to have a diagnosis of a behavior disorder compared to privately insured families. So there's some evidence that there's some bias in how we're identifying these groups, and we want to make sure that we really are equally identifying when individuals truly have ADHD. Yeah, next slide. So when we think about the best practice treatment approaches for ADHD, the recommendation from the CDC and the American Academy of Pediatrics and a whole bunch of other groups too, is that we use a 3-prong approach. The first prong is school-based supports and interventions. The second is behavioral family therapy. That would occur outside school where the parents and child together are working with a behavioral social worker, therapist, or psychologist. And then the last piece is medication. So for children under the age of 6, the recommendation is that you start school supports and behavior therapy before considering medication. For kids over the age of 6, the recommendation is to do everything all together. Um, what we know from the current CDC data is that in Kansas, kids are more, I don't have the data on school-based supports, unfortunately, but I can tell you the data on medication and behavior therapy. In Kansas, about 63% of children who have ADHD take medication for it, whereas only 42% receive behavioral therapy. That's something that's concerning to me. I have a lot of questions about why that is. I think part of it is we have difficulties with access to behavioral therapy in Kansas. But then I also think making sure that everyone who works with kids know that it's really this kind of three-prong approach is what the treatment should be for ADHD. Too often, I think the understanding in the popular media and stuff like that is it's really this medication approach, but it really should be all three together. The CDC has some fabulous, really family-friendly handouts that talk about this three-prong approach and also talks about what exactly good therapy should look like. And we will send those out along with the resources after the program today. Next slide. So the question is, so we know that it's kind of this three-part approach, but you at school only have control over one part of that, right? So what you can control is the school-based accommodations and supports. One of my favorite resources is using a daily report card or a homeschool note. And actually a lot of research has been done on this, and it shouldn't be surprising at all that it's really effective. It's a great way that what you're doing at school, that we can then get families to use at home. And that way we're trying to get a little bit more of that home use of the same behavioral principles, which is the idea of that behavioral therapy. So the homeschool note should identify a few concrete behaviors. So the example I have here in green is completes assignments with 80% accuracy, follows teacher directions with 2 or fewer reminders, and is respectful to peers with 2 or fewer reminders. There's even a simpler one above that that just says follows directions, stays on task, and completes assignments. And then the idea is that you would send home that quick daily report card each day, and then try to engage the family. Ask the parents, what do they think would be easy and meaningful rewards? And we could either think about having those rewards be things they earned at school, or it could be things they earned at home. I think it really depends on the individual child, which one, home versus school rewards, is going to be the best or most effective. I prefer to stay away from prize boxes or food-based rewards. And instead, I really like activity-based rewards or giving kids more choice and autonomy. Those are often really motivating for kids, and they don't get bored of them quite as easily as they do of like a new toy or a sweet. Although most kids don't get sick of sweets, it's more of I want to make sure we're reinforcing healthy eating overall. Side note. Okay, so things like electronics, renting a movie, trips to the park, bringing a special note to the front office, helping take care of a class pet, or giving a break in the sensory room are often great rewards. And then the other thing we can also do is if you're finding that you're using a reward system at school that's working super well, tell the family what it is. I'm often doing that behavioral family therapy, and I ask families, what are they doing at school that works well? And they say, I have no idea. If you're able to let them know via a short note or say, hey, we're trying this at school, why don't you try it at home? Let me know if it works. That's a great way that will have more consistency, which we already talked about is super important, and you're helping to have a little bit of impact across settings.